Hello, everyone. Thank you for attending our Health Insurance 101 event this Friday afternoon. My name is Puja Tawari, and I, along with co-organizer Maria Rodriguez and Aki, on behalf of VHP and Aki, work in the Sales and Broker Relations Department under our manager, Ashley Bejarano. I will now hand it over to my co-organizer, Maria, to say a few words.
Thank you, Pooja. Hi, everyone. My name is Maria, and I'm very excited to host these events along with Aki. Pooja and I wanted to provide our community with informational events that we would all find helpful during this pandemic. We can't thank you enough for participating and for taking time out of your busy days to join us. Now, to get started, Pooja will speak about the agenda.
This is our agenda for the event. We ask everyone who is not presenting will remain muted. If you have any questions throughout the presentations, please write them down. There will be time at the conclusion of the presentation to have a Q&A session. But now we will kick off the presentations by starting with Ashley, who is going to do an introduction to VHP.
Hi, so I'm Ashley Bejarano. I am currently the sales manager, and I also handle our broker relations. So what is Valley Health Plan? For those of you who may not know us too well, these are some points that we want you to kind of understand a little bit better about us. So first and foremost, VHP is local. VHP was actually created to provide medical coverage to Santa Clara County employees, and we have been serving Santa Clara County for well over 30 years. And our office is located right here in the heart of San Jose. Outside of COVID, we normally take in-person appointments to help our members or to help those who are looking for insurance. So we do take a very hands-on approach to providing care to those who live and work in Santa Clara County. We're also a quality option for people who live and work in Santa Clara County. Our network gives our members access to providers and facilities that they know and love that are right here in their community. And we also provide access to convenient things like our MD Live telehealth and pharmacy services that they're familiar with, like Walgreens and Costco. So we're also very affordable. VHP is a nonprofit HMO, and we have made affordability a priority year over year, and that will be the same going into 2021. We are proud to offer the lowest cost Cover California plans for the most popular metal tiers. And we hope to continue serving Santa Clara County and being able to continue to offer an option that is affordable. Next slide. So I'll go ahead and hand it off to our representative from Aki.
Hi, good afternoon. My name is Leticia, and I am here to present to you guys our organization, which is AACI. Next slide, please. Our mission at AACI is to strengthen the hope and resilience of our community members by improving their health, mental health, and well-being. Next slide. We offer culturally competent care, and our team of 170 plus members who speak 40 languages has served 19,000 plus clients in the community and community members over the past year. Next slide. Next slide, please. One of our departments at AACI is our health center, where we provide high quality care regardless of a patient's immigration status or ability to pay. And on this slide, you can see our healthcare center team, which offers services such as sports medicine, integrated behavioral health, healthcare for children and adults as well. Next slide. We have a patient navigation team who helps patients with navigating the healthcare. We interpret during office visits in your language. We help find community resources, and we also help resolving billing issues. In our next slide, you can see one of our patients who expresses that at AACI. Next slide, please. In this slide, you can see one of our patients who expresses that at AACI there is someone who speaks your language that will help you express your thoughts. She mentions that when she walks in through the doors, she always sees smiles, and she's always happy to be here at AACI. Next slide. At AACI, we also have enrollment counselors who can help you enroll into Cover California, Medi-Cal, and other programs. Our enrollment counselors help screen the patients so that they can find the best plan that's suitable for them. Next slide. One of our other departments at AACI is our behavioral health department. We offer counseling services to individuals, groups, families, and the services are offered for ages 6 and up. Next slide. Our wellness department, we have an emergency shelter for domestic violence victims. We also help human trafficking survivors. We provide HIV education and testing. We have programs for the youth. We have DUI programs, and we also have a senior wellness center. Next slide. Next slide, please. At AACI, our advocacy team Thank you. At AACI, our advocacy team aims to elevate the voices of vulnerable communities with our local decision makers. And our agenda is shaped by the issues that affect our patients and clients, such as immigration, public charge, healthcare for all, the census, voter registration, and more. Next slide, please. If you are interested to become a volunteer, you can send us an email at info@aaci.org to get more information. Next slide. And also, we understand that during this pandemic, times are hard. Our health center is offering COVID-19 testing at no charge every Friday, 9 through 12 p.m. at our 749 Story Road location on the east side of San Jose. No appointment is needed. You just walk up to our station and get registered. Next slide. If you have further questions regarding any of our AACI services, you can call us at 408-975-2730. Thank you.
Thank you, Leticia. So now I just wanted to say that sometimes it can be really confusing when understanding insurance terms. So Puja and I wanted to make this process easier for people to be able to distinguish between what each word means. We wanted this breaking down the basics of health insurance event to make health insurance information more accessible to everyone. To begin with, we will be comparing two terms that are usually pairs with another that can be confusing to understand. So we will start off by premium versus deductible. Hey Puja, how are you doing? Do you have health insurance?
I do have insurance. I'm currently covered by VHP with the Platinum plan, which I found the most beneficial for myself.
Oh, that's great to know. What do your premiums and deductibles look like?
Well, for this plan, my premium is a bit high, but I don't have to worry about meeting my deductibles.
So I'm assuming that it basically balances out?
Yes, basically, by paying a higher monthly cost will leave me paying a lower copay when it comes to clinic visits or any prescription.
Okay, so I understand now. It seems like you will be saving more money over the year if you are using your health services often with this particular plan.
Exactly. It's all based on the frequency of care that you're looking for.
Thank you. I will definitely keep my eye out when looking for a plan. So now we will discuss more what a premium and deductible are. So a premium is the amount of money an individual or business pays for an insurance policy. As for the deductible, it is the amount you paid for covered healthcare services before your insurance plan starts to pay. And we have some examples here that VHP has. So now I will be discussing the bronze plan versus platinum plan. These are, we're comparing two metal tier options that VHP has. So the bronze plan, it's a low premium and high deductible. Usually costs will be higher over the plan year if you need to use your plan often or have a major medical need. As for the platinum plan, typically it will save you the most money over the plan year if you need to use your plan often or foresee major medical need in a given year. Next slide, please. This slide gives a basic understanding of the 2020 metal tiers that VHP has to offer. As you can see, the bronze plan is the most basic, and then it goes all the way up to the platinum. There are the prices that the different categories have. We also have this chart on the website if you would like to look more at it and understand the prices. Next slide, please. So in-network versus out-of-network. Hey Pooja, does your plan offer you a variety of providers and health facilities that you can go get medical attention?
Yes, VHP has a variety of locations that are included within their in-network providers.
That's great to hear. It is always valuable to have many options to choose from.
Yes, I usually visit the Santa Clara Valley Medical Center, which is convenient for me because of how close it is to my home.
I also live close to the hospital, but unfortunately, that center is out of network for my plan.
That's unfortunate. Always make sure to explore your options for in-network and out-of-network providers that are listed within your insurance plan.
I definitely will when I consider changing insurance plan in the future. Thank you, Pooja. So now to further discuss in-network and out-of-network. In-network is providers or healthcare facilities that are part of a health plan network of providers with which it has negotiated a discount. As for out-of-network, it's typically the providers of facilities that do not have a contract with their health insurance company. We also have an example here of the hospital locations, lab locations, pharmacy, and urgent care locations that VHP has a contract with to be in network when you get an insurance plan with us. Now, employer group versus individual and family plans. VHP has many different plans available to you based on your needs. The employer group, it is a health policy that is selected and purchased by your employer and offered to eligible employees and their dependents. Monthly costs are paid pre-tax from your paycheck. As for individual and family plans, a health policy that you can purchase for yourself or your family through Covered California or by contacting an insurance provider directly. Basically, they would be on the individual's need and what they are looking for. Next slide.
Okay, so now I'll be going into the difference between Covered California versus Medi-Cal. Covered California is a free service that connects Californians with brand name health insurance under the Patient Protection and Affordable Care Act. Medi-Cal, on the other hand, is a program that offers free or low-cost health coverage for children and adults with limited income and resources. Covered California accepts Medi-Cal applications all year, no qualifying life event required. Next up, we have our HMO versus PPO plans. So, hey Maria, how are you?
Hey Pooja, not so well. Health insurance is so confusing.
Why? What's wrong?
There are so many terms, but I'm having a hard time understanding the differences, like HMO plans versus PPO plans. After doing a Google search, all it helped me understand was that HMO plans can be cheaper.
Yes, usually they have lower premiums or low to no deductibles. However, you are usually required to select a primary care physician, PCP, especially because if you need other work done like screenings or treatments for a disease or more, your PCP would refer you to a specialist.
Okay, I see. So then wait, how does a PPO plan differ? Would I have to pay more? Would I be required to select a PCP?
So with PPO plans, they have higher premiums and usually have a deductible. However, you do not need to select a PCP, and no referral would be needed to see a specialist. Also, usually you have some out-of-network coverage.
How do I know which one is best for me?
You could speak to insurance consultants, brokers, certified enrollment counselors, and more.
Great, thanks. Thank you for all the information. I'll go ahead and look at the directory to get their numbers.
So to go into detail, an HMO plan is a health maintenance organization, while a PPO plan stands for Preferred Provider Organization. So HMO plans tend to have lower monthly premiums compared to PPO plans, which usually have higher monthly premiums. But HMO plans, you have to select an in-network PCP with, while PPO plans, you don't necessarily have to select a PCP. Like Ashley mentioned earlier, Valley Health Plan is considered an HMO plan. Now, the difference between free benefits versus cost share benefits. So free benefits are a benefit that is paid by your plan, so it's practically free for you. So these could include things like flu shots and annual physical immunizations and birth control, while cost share benefits can be split into two categories, covered versus non-covered. So a covered cost share benefit would be something if you had met your deductible but not your out-of-pocket maximum, you might owe a copay or insurance. Versus non-covered cost share benefits, these services are not paid at all by your health insurance plan. So any money that you pay will not be counted toward the deductible or out-of-pocket maximum. Now we have the difference between open enrollment versus special enrollment. Hey Maria, I'm really stressed out right now.
Oh no, why? What's going on?
So I had health insurance through my job, but because of COVID-19, they started laying off people and I was let go.
I am so sorry to hear that, Pooja, but you don't have to stress about health insurance. Have you heard of special enrollment and open enrollment?
Sort of, but I don't really know what they mean.
Well, an open enrollment period is a set time during the year when you can switch your health insurance for any reason. For example, wanting a different insurance plan. But a special enrollment period is when you have the ability to switch your health insurance outside of the set period, only if you have something called a qualifying life event.
So is losing my job a qualifying life event?
Yes, unfortunately, other qualifying life events, including things like getting married, starting a family, and with this pandemic, several companies, including VHP, had done special enrollment periods related to COVID-19.
Ah, okay. I'll look more into that. Thank you, Maria. So, like it was mentioned, open enrollment is a set time during the year when you can enroll in a new plan or switch your health insurance without needing a reason to. Special enrollment is the ability to enroll in a new plan or switch plans only if you have a qualifying life event that was mentioned. So this could be losing your job, getting married, starting a family, and also there were special enrollment periods related to COVID-19. So some more insurance terms we'd like to discuss. So an out-of-pocket maximum was briefly mentioned before. So it is the maximum amount of money that you have to pay for your health care in a year. And this includes co-pays, co-insurance, and deductibles. This all these things that you pay go towards your out-of-pocket maximum. Monthly premiums, on the other hand, do not go towards your out-of-pocket maximum. And to give you an example of what an out-of-pocket maximum would look like, with VHP, there are different like plans and pricing versus Region 7 or if you're in Region 9. However, for the individual plan, whether or not you choose bronze, silver, or gold tiers, if you are a person on this plan, your out-of-pocket maximum would be $7,800 a year. A claim is a formal request to an insurance company for compensation for a covered service. So say you go in for like a screening or something, afterwards you would submit a claim to your insurance in order to get that screening covered. A provider, we briefly mentioned that this is a person determined to be capable of providing healthcare services. So this could be a hospital, this could be a clinic. What this website that we have right here, it's an example of how you would look for like a provider. So VHP has that search engine where you can go in and look for providers that are in network, because it's important to distinguish whether or not your provider or the provider you would like to go to is in network versus out of network.
Thank you, Pooja. So I'll discuss 3 more insurance terms that are commonly heard of. So the first one is certification of insurance. It is issued by an insurance company or broker that verifies the existence of an insurance policy. Typically, it includes information on types and limits of coverage, insurance company, policy number, name insured, and the policy effective periods. As for coinsurance, this is the percentage of cost of a covered healthcare service you pay after you've paid your deductible. So a coinsurance only applies to covered services. If there are any expenses for services that the plan doesn't cover, you'll be responsible for that entire bill. It's always good to make sure to review your benefits booklet or call our plan provider. And for cost sharing, it's the amount you pay for services because you have insurance. So it's basically the share of cost covered by insurance that you pay out of your own pocket. Some examples are deductibles, coinsurance, and copayments. So another big component when researching about the perfect insurance plan for you is getting anxiety. We've all been there, but don't worry, we got your back. In the next slide, I will be talking about 3 ways to relax while searching for plans. It is completely okay to not know what certain insurance terms are or how insurance plans work. You're not an expert and you shouldn't be stressing about every single term of insurance. Second thing is, take a break. Do activities that help ease your mind. It's always best to have a clear mind before beginning the process of finding the perfect plan that has all the qualities that you are in need and looking for. And the most important one is asking for help. We are here to help and guide you to picking the right plan. Always remember that asking questions will not only help you understand better, but it will make you more confident on choosing the right plan.
So, in order, if you have any questions for health insurance related things, who to contact. So first, we have Valley Health Plan VHP. You can contact member services for any information related to that, and those are the times, that is their website, and that is the phone number you can call. Asian Americans for Community Involvement has certified enrollment counselors ready to help you. It's available in multiple language. There's their website and phone number. And finally, we have Covered California, where you can ask questions, start or finish an application, compare plans. They're available every day. That is their website and also their phone number. So the easiest way to avoid stress and anxiety when shopping for health insurance is understanding your coverage options and know how the benefits work for you.
Time for Q&A. So first, we will have AACI kick off our Q&A with questions for VHP. Leticia, you can go ahead and ask the most common questions that AACI comes up with.
Hi. Yeah, so some of our patients ask if I go to Stanford Hospital, does my insurance cover?
So to answer that question, Stanford is a part of our network. However, Stanford is only available on referral for tertiary services. So to put that in a more simpler way, what that means is that um, individuals can go to Stanford on referral only if those services are not available from a provider in our base network, meaning depending on where your physician, your primary care physician, has permissions, that might mean that Valley Medical Center or O'Connor is a facility that they have permissions. So one of those facilities, if they do not offer the services that are needed, then that referral for Stanford would be given. It would still go through the standard referral and authorization process with our member services unit.
What happens if I get hospitalized for COVID-19? Is everything going to be covered by VHP through Cover California?
So COVID-19 related services are being covered 100% at this time. In addition, MD Live telehealth fees are currently being waived for COVID-19 related virtual appointments.
How do I know how much will be covered and how much will I have to pay out of pocket?
So for that, it depends on which plan you are in. Um, the benefits are going to be the same from metal tier to metal tier, but what's going to change will be the deductible, if there is a deductible, and the copay, which is how much you would be paying out of pocket. If there is a deductible that is applied to the service, then you would be paying for the service in full until you reach that deductible. Otherwise, if the deductible doesn't apply to that service, then you would just be paying whatever the applicable copay is depending on your metal tier. And you can find all of that information on our website or in your statement of benefits and coverage.
What is a copay and when do I have to pay it?
So copay is that set amount that is given for a specific service. So there's a different copay for seeing a specialist. There is a copay for getting an x-ray. There's a copay for going to the emergency room. And you only pay that copay when you receive that service. You will pay that to the provider directly.
Why is my doctor's name not on my insurance card?
So your PCP should appear on your ID card. ID cards are renewed every year. So if there have been changes, it can take up to 16 business days for that new ID card to be sent to you. Also, if you've recently changed your ID card, that would again require a new one to be sent to you. And there is some waiting time for that as well.
Thank you.
Thank you, Ashley and Leticia. So now in this part of the event, we are going to unmute everyone to give you guys a chance to ask, any or all questions related to health insurance. As well, we do have the chat option, so you can go ahead and also type in your question there and one of us will answer it. Okay, so we'll give, let's see. We'll give like about 5 to 10 minutes for any questions. Feel free to unmute yourself or type it in the chat.
So we have one question that came in through the chat. Will there be a recorded version of this? Yes. So we are recording this as well as our future events. We hope to record They will be posted on the Valley Health Plan website. Another question came in, what is Valley Health Plan? I don't really get it. So Valley Health Plan is a health insurance organization. We are an HMO. We are based here in San Jose, and we are actually operating as part of Santa Clara County. We offer plans available to the public through Covered California. And for those who do not qualify for Covered California, they can enroll directly with Valley Health Plan as well. And we also manage the care for coverage programs to the County of Santa Clara. And we also offer group coverage to employees of Santa Clara County as well. All right, does anyone else have any other questions they would like to ask at this time? So another question through the chat, does VHP have an app like Kaiser? At this time, VHP does not have an application for mobile devices. However, we do have a member portal that is accessible from the VHP website. At the top right corner of our website, there is an icon that looks like a person. And if you click on that, a VHP member who is enrolled in Covered California or in our individual and family plan can use their member information to register for our member portal. The portal will give you access to a temporary ID card. You can request a PCP change and see who your current PCP is, as well as check claim status through that portal.
Hi, I have a question. Does Valley Health Plan offer insurance to clients who don't have a social security number?
Yes, so our VHP Direct product is actually perfect for those who do not have a social security number. We do not require that as a field or piece of information that's needed in the enrollment application. Our enrollment application is actually very simple. And the plans are mirrored to the Covered California plans. So it's the same benefits, network, and metal tiers that are available for the Covered California plan. The only thing to note of this direct plan is that it is not subsidized. So people enrolling in this plan would be paying the full monthly premium based on the region that they live in. So that plan is available to those who live in Santa Clara County and in select cities in San Benito County as well.
How can a person get enrolled into the direct Valley Health Plan insurance?
So for the VHP Direct, they can contact a broker. We list all of our contracted brokers on our website. And we also have our application available on the VHP website. there is a fillable PDF. Or if someone would like assistance over the phone, they can call VHP directly, and an individual from our sales team can assist them over the phone. And then the application would go directly to their email. It is powered by DocuSign, so you would be able to sign electronically, so that way there's no need for any kind of in-person interaction.
Does Valley Health Plan cover any past month services, like previous services? For example, if the insurance starts on October 1st, is it possible for it to cover services from the past 3 months?
No, unfortunately, retroactive coverage like that is only available for those who enroll in Medi-Cal. For Covered California and the VHP Direct, retroactive coverage is not available.
Okay, thank you.
Welcome. All right, I will make one last call for questions if anyone has any other lingering questions they would like to ask.
Where is the office located?
Our VHP office is currently located on North First Street and Component. We're actually directly across from one of the light rail stops, so it's very accessible. But unfortunately, at this time, our offices are closed and all of our staff is working 100% remotely.
Do you guys have an idea of when the offices will be open, or?
Right now, we are estimating that we will remain working remotely at least until February. I mean, realistically, it really depends on how our county continues to perform. You know, if the color rating continues to move in a more positive direction, then once our county meets the standards, then our employees would be able to go back to working in office. But that being said, VHP is prioritizing our staff's health and safety, and working in a close office environment we know comes with a lot of risk. So for us, I believe February or maybe even sometime mid-year next year.
Oh, okay. Thank you.
You're welcome. All right, Maria and Puja, do you want to take over?
Yes, thank you, Ashley. So I believe that Puja has some concluding remarks, and then I'll follow up after her.
Yes, thank you, Maria. So we just want to thank again everyone who attended this event, from our presenters to our attendees. Special thank you to Asian Americans for Community Involvement for partnering with Valley Health Plan. This slide up here shows our flyer for VHP's upcoming virtual events. So in case you did not know, this event is actually the second of 4 events that VHP is putting on throughout the month of September, and our last one is in October. Every single one of you is invited to our other 2 events coming up. Also, VHP and AACI have created a short post-event survey. It is a Google form that Maria will drop into the chat, and we can also drop the link on our Facebook event pages as well. It just asks questions about your opinion of the virtual format of this event, and it would be very beneficial for us if you could provide your feedback. It would literally take less than 5 minutes, so I mean, if you wanted to, you could do it now. Now that is all that we have. So we just want to say thank you again for attending our event. Have a good rest of your day and weekend, and we're looking forward to seeing you at a future virtual event. Thank you.
Thank you. Thank you, Pooja. I have gone ahead and put the link on the chat. With that, you guys can go ahead and take a couple of minutes and fill it in. We need to thank the